introduce Dr. Stefan Piper. He will do the presentation on fluoroquinolone, adverse effect to fluoroquinolone. Dr. Piper?
Can you hear me? Good morning.
Yes, we can. Thank you.
Okay, all right. Fluoroquinolone adverse events, the need for an ICD-10 diagnostic code. Good morning. My name is Dr. Stefan Pieper, speaking on behalf of the Fluoroquinolone Toxicity Study Group and patient advocates. Next slide. Overview. Rationale for an ICD-10 code. Fluoroquinolone background. Occurrence of adverse events. Adverse effect statistics 2022. Fluoroquinolone FDA warnings. FDA significant safety concerns. Ineffective patient-doctor experience. Selection of antibiotics that have ICD-10 codes and black box warnings. And conclusion. Next slide. Rationale for an ICD-10 code. The fluoroquinolone class is one of the largest and most frequently used antibiotic group, but is the only group not represented in the current ICD-10 category, although statistically, according to the FDA, this group has by far the highest rate of side effects with regard to poisoning symptoms. In the current ICD-10 code, 7 important antibiotic classes are listed under the heading poisoning, all of them discovered or introduced in the 1940s and 50s. However, fluoroquinolones, the youngest and most problematic group, which was only developed around 20 years later, are not represented. The exclusion of fluoroquinolones is most likely due to historical rather than substantive reasons. To correct this systematic omission, we request the introduction of an ICD-10 code for fluoroquinolone poisoning, following the other groups in a logical, hierarchical sequence. Next slide. Fluoroquinolone background. Fluoroquinolones with best known and most prescribed representatives, Cipro and levofloxacin, are the first fully synthetic antibiotic group ever and were introduced in the 1980s. They turned out to be one of the most effective, but also one of the most toxic antibiotics of all. They have a distinct spectrum of adverse effects. The side effects, while rare in percentage terms, are frequent in absolute numbers due to the vast quantities of prescription. Certain adverse effects flagged by the FDA can manifest collectively as a severe condition, usually resembling a syndrome in its clinical presentation. Vast number of prescriptions will reflect in the higher occurrence of adverse effects, severity, and potential for causing disability. Having said that, as noted by the FDA, fluoroquinolone's adverse effects are underreported. In the year 2022, in the US alone, there were almost 15 million total fluoroquinolone prescriptions dispensed. And please note that these statistics do not include dispensary in hospitals, nursing homes, urgent cares, or surgical centers. Next slide. Occurrence of adverse events. With regards to adverse events, the Open FDA reports more than 100,000 cases in the period between 2004 and 2023. This is literally 4 times the number of reported side effects compared to the second highest reported drug group, and these are corticosteroids. According to FDA, 87% of fluoroquinolone's severe adverse events resulted in hospitalization, disability, or other serious and life-threatening conditions, or even death. Next slide. Adverse events statistics 2022. A selection of serious side effects, including mortality and prescription frequency in 2022, are impressively shown in this graph. Next slide. Fluoroquinolone FDA warnings. A large number of multi-system damage cases have been documented for fluoroquinolones, but by numerous data, not least by the FDA itself. This resulted in 5 public warnings from the FDA between 2008 and 2018. It is also worth mentioning the seriousness of side effects such as risk of tendinitis and tendon rupture, irreversible peripheral neuropathy, potentially irreversible side effects of the tendons, muscles, joints, nerves, and central nervous system, psychiatric effects, as well as aortic tears and dissections. Next slide. FDA significant safety concerns. Adverse events from this antibiotic class range from acute to chronic, as noted in numerous FDA black box warnings. Fluoroquinolones should be reserved for use in patients who have no alternative treatment options. Side effects can occur hours to weeks after exposure to fluoroquinolones and may potentially be permanent. Side effects continue for an average of 14 months to as long as 9 years or continued. The FDA reported statistics in 2015 showing that the top 5 disabling antibiotics were all fluoroquinolones, ranging from about 10 to 30% of the total disabled percentage. Next slide. Ineffective patient-doctor experience, current situation. Due to the lack of ICD coding, the doctor-patient relationship is clearly compromised. As this means that the link of symptoms to the fluoroquinolone prescription is not made, but still there is no ICD-10 code, leading to wrong treatments and wrong referrals, in turn leading to loss of trust by affected patients, with some even reporting separating from healthcare altogether, leading to loss of care for their other health conditions. The diagnosis validated by a code points doctors to the right literature that helps them to help patients. Finally, an ICD code is needed most of all by the affected patients, many of which report a terrible care experience as the physicians dismiss and even disbelieve their symptoms and deny a possible relation to their preceding fluoroquinolone administration. Without ICD code, the consequences of such poisoning remain unclear to both the doctor and the patient. Conclusions, guidelines, and recommendations for action cannot be followed, and any specific option cannot be discussed. This in turn can lead to aggravation to the level of requiring palliative or hospice care, increased risk of depression and suicidal tendencies, worsening of symptoms and further complications, and of course, the great risk of the patient being stigmatized. Next slide. Selection of antibiotics that have ICD-10 code and black box warnings. In this graph, we see the description of the coding of the various antibiotic classes and their individual representatives in the current ICD-10 under the heading poisoning by, adverse effects of, and underdosing of systemic antibiotics. The chlorphenicol group is missing since there is no black box warning for this class. Otherwise, this list should be largely complete as far as the common antibiotics are concerned and shows the glaring need for ICD coding for fluoroquinolone poisoning. For this topic is not captured in other diagnoses and should be recognized as a distinct entity. The FDA efforts and international research with more than 9,000 publications and a PubMed search paint a clear picture of the need for ICD coding. Next slide. Conclusion. Although one of the most clinically important antibiotic group, fluoroquinolones are unrepresented in the ICD system. Fluoroquinolones' adverse events occur 4 times more than the second highest drug class. Fluoroquinolones can cause disabling and irreversible systemic damage. Such severity of adverse events requires the most substantiated coding. The large number and clinical significance of side effects require the prerogative of documentation. ICD-10 codes are needed to help individuals seek a diagnosis and treatment. ICD-10 codes are needed to obtain the needed statistics and scientific data. All patients deserve diagnosis and the same standard of care. Due to the enormous number of side effects documented by the FDA, the greatest need by far for ICD coding within the antibiotic group is clearly in the fluoroquinolone class, and it is here of all classes that the physicians who treat patients do not have this important option. Thank you so much for your kind attention.
Thank you, Dr. Pieper. Now I will go to the tabular modification, which can be found on page 20 of our topic packet. At T36, we were creating a new subcategory for T36A, poisoning by adverse effect of underdosing of fluoroquinolone antibiotics. with new codes T36AX, poisoning by adverse effect of underdosing of fluoroquinolone antibiotics, with the new code T36AX1, poisoning by fluoroquinolone antibiotics accidental, unintentional, at the AX2, poisoning by fluoroquinolone antibiotics intentional, self-harm, at the AX3, poisoning by fluoroquinolone antibiotics assault, at the AX4, poisoning by fluoroquinolone antibiotics undetermined, AX5, adverse effect of fluoroquinolone antibiotics, and AX6, underdosing of fluoroquinolone antibiotics. Moderator, at this time, are there any hands raised?
It looks like we do have a raised hand. I'm looking for her. Oh, did she just disappear? Sarah was her name. There she is. Sarah, you are able to unmute yourself.
Hello, can you hear me?
Yes.
Great. Hi, I'm a board member with Fluoroquinolone Toxicity Study, which is a grassroots research foundation representing thousands of individuals experiencing these adverse effects. The absence of a diagnosis code hinders access to appropriate treatment and social and medical benefits. For 36 years, the affected community has awaited recognition and assistance and now seeks your utmost support in the request for a code. Thank you.
Thank you, Sarah. Moderator, are there any other hands raised?
I don't see any other raised hands, but there are some questions in the Q&A.
Okay.
If somebody on the team would like to read those.
Please see several comments from Mr. Singh in support, it appears, of the topic. I want to make sure that I am conveying his thoughts correctly. And let's see, we have Dr. Linder has stated, is there a typo? Isn't T36.A also a new code?
Yes, Dr. Linder, that is correct.
We do have others. I believe Rick is stating he's also in support. Thank you for the meeting. I think these are comments relevant to support of the topic in general. Thank you.
Okay, great. Thank you, Monica. Moderator, are there any other hands raised at this time?
No other hands. Oh, go ahead, David.
I was just going to comment that the email address to respond to is in the topic packet, and we can share that in the chat answers also. But that's one that we've shared a few times, I think, but we can do that again. So, and we're welcome to have people comment if they like in directly, and we are following the questions and answers. We do have a number of people expressing support and stating that we have a need for codes for this.
Yes, thank you. As there are no other questions or hands raised,
No other hands raised at the moment.
great. Thank you, Dr. Pieper.
Thank you very much for listening.
Moderator, at this time, we are running a bit ahead of schedule. The next activity would be lunch. However, we are going to make one modification on the agenda, and we will have Shannon Lamptey, McConnell of our team, will now present on the Gulf War topic. Shannon, you just